Primary progressive MS is a slow thing that happens over months to years. So it's more of a gradual symptom, and then it doesn't typically go away. It might kind of plateau, flatten out, but it doesn't go away. Multiple sclerosis is a disease of the central nervous system. It is an autoimmune condition, and so that means the immune system is activated against itself. The immune system is the system that we have in our body to protect against virus, bacteria, any sort of infection. And instead of doing that, for some reason in multiple sclerosis, it turns inward, and the immune system attacks the parts of the central nervous system, the brain, spinal cord, and the optic nerve, which is the connection from the eye to the brain. The two main sorts of MS are relapsing remitting MS and primary progressive MS. An MS relapse is a patient that has a new symptom that is somewhere on their body, localized on their body, and it lasts longer than 24 hours. And it comes on usually over the course of days to weeks, and then it goes away over days to weeks. Primary progressive MS, so the difference with that is that a patient won't have these relapses where it's, something that's new over days and weeks and goes away. With primary progressive MS, they've never had a relapse, and it's usually just something that's a little bit insidious. It comes on slowly, and it's usually a walking challenge that happens over months and years. On MRI, relapsing remitting MS and primary progressive MS can look almost identical. There is a slight difference at times where patients with the primary progressive version, they may have more lesions in their spinal cord compared to their brain, but truthfully, they also may not. So the most important thing always is just to listen to the patient. And the patient will tell you the story, and it's either one where they've had some episodes that came and went, or a person with primary progressive MS, in contrast, they would just tell you that 5 years ago they might have had, just a touch of a trouble walking. 2 years ago it was more, and now it's more. So it's a very different story. Primary progressive MS and progressive MS in general has been a greater challenge in terms of getting treatments available for those patients. But just recently, we had the first treatment approved for primary progressive MS. It is a treatment that also works for relapsing remitting MS. So it's another one of these treatments that decreases inflammation. But it showed that it worked in a group of primary progressive patients.